administering the subcutaneous injection, now we are going to administer the intramuscular injections. In administering intramuscular injections, the equipments we'll be using are the following: the 3cc syringe with needle and another extra needle for preparing the vial, alcohol prep pad, alcohol for sanitizing, disposable gloves, and of course the vial, and the medication record of the patient. Thing that we are going to do is to perform a hand hygiene. It's either to wash our hands or to sanitize them, and observe the appropriate infection control procedures. Then, we are going to prepare the medication from a vial or ampule for drug withdrawal. In administering medication, we must always remember the 10 rights. First is the right medication, right dose, right time, route, client, client education, documentation, right to refuse, right assessment, and right evaluation. In preparation, we must first check the medication sheet, check the label on the ampule carefully against the medication sheet to make sure that the correct medication is being prepared. Follow the 3 checks of administering medications. Read the label on the medication. First, when it is taken from the medication chart. Second, before withdrawing the medication. And third, after withdrawing the medication. Then, we must organize our equipments. In preparing medications from vials, the equipments we are going to use are the following. Of course, the vial. So, I have here a 50 ml sterile water for injection vial. This is the only available here in our community. Alcohol for sanitizing, alcohol prep pad, a syringe with needle, and since I don't have any filter needle, so I'll be using another set of extra syringe with needle. So first, we are going to sanitize our hands. And observe the appropriate infection control procedures. Next, we are going to mix the solution by rotating the vial between the palms of our hands. Then we are going to remove the protective cap or clean the rubber cap of the previously opened vial with an antiseptic wipe by rubbing in a circular motion. Next, we are going to attach the filter needle to the draw-up pre-mixed liquid medication from multi-dose vials, and remove the cap from the needle. Then withdraw up into the syringe the amount of air equal to the volume of the medication to be withdrawn. We must also remember that
the parts of the syringe that we can only touch are the plunger, flange, this one, and the barrel, this one. This one here. So as if our order says 2 ml of medication, so we are going to drawn up into the syringe the amount of air equal to the volume of the medication to be withdrawn. Here. Here. Now we are going to carefully insert the needle into the upright vial through the center of the rubber cup, maintaining the sterility of the needle. Then we are going to inject the air into the vial, keeping the bevel of the needle above the surface of the medication.
Next, we are going to introduce ourselves and verify the client's identity. After, we are now going to provide privacy for the client. It's either to close the door or to close the curtains. Next, we are going to assist the client to a position depending on the chosen side. So, as if we already positioned the client into a ventrogluteal position. Now we are going to explain the purpose of the medication, including the relevant information about the effects of the medication. Then next, we are going to select a site. So as if this is the site that we select. It should be free from skin lesion, tenderness, swelling, or localized inflammation, and one that not been frequently used. So after we locate the exact site for the injection, the next thing that we are going to do is to clean the site with an antiseptic swab. And we're going to use a circular motion starting at the center and move outward about 5 centimeter or 2 inches, and then we are going to allow it to dry. Next, we are going to remove the needle cover and discard without contaminating the needle. Then we are going to hold the syringe between our thumb and our forefinger of our dominant hand and inject the needle quickly and firmly at a 90-degree angle and insert the needle into the muscle. So here is our dominant hand and here is our thumb and forefinger. Then we are going to release the skin. Okay. And hold the barrel of the syringe steadily with our non-dominant hand and aspirate by pulling back on the plunger with our dominant hand. We're going to aspirate for 5 to 10 seconds.
Next, we are going to slowly inject the medication. And quickly, we are going to withdraw the needle while applying pressure with a dry sponge. Then after, we are going to assist the client to a comfortable position, discard the uncaped needle and syringe with a safe receptacle, remove our gloves and wash our hands.
And lastly, we are going to document all relevant information of the client.